So here's a very interesting case here of a female patient of 60 years of age. She came in complaining of just a severe vestibulopathy. So she had a left cholesteatoma, and she had that removed, and also had a left mastoidectomy in 1981. So she also had, a few years later, had her left labyrinth removed as well. So this created some just severe symptoms. Actually, she had awful symptoms even prior to the surgery, which is partially why she had it done. But they continued to persist in just debilitating ways. So yes, she has 100% hearing loss on the left now as a result of the surgery. But whenever she hears noise that she's not expecting, or even if she tries to anticipate a visual stimulation like making hand gestures when you have a conversation with this patient, it makes her startle very, very powerfully. And the startle is so strong that it can actually make her fall. And she does fall quite a bit. So what she has to do is she has to live her life with her eyes closed a majority of the time. So this really takes away her ability to be autonomous and to be able to live a normal life. You can imagine that the amount of energy that her brain is consuming is just astronomical. So she has chronic fatigue and she has brain fog. It's just exhausting to live in this way. She doesn't get dizzy, but it really is environmental stimulation that move her. So when there's movement in her environment, it moves her body. It propels her, it pushes her to the ground. So visual and auditory stimulation or perception is really what the problem is. And it seems to be stronger on the right side, coming from the right compared to the left. So she has to keep her eyes closed most of the time. She does have a little bit of tingling too in the lateral right aspect of her foot. So I did a detailed exam, and here are some of the findings that I wanted to share with you because they're a little bit more pertinent than most. But so gaze holding to the right generates more nystagmus than any other position. So right there, I was thinking, okay, she probably has a right leaky neural integrator. This is a central brain lesion. I can move her head. She does have a proper vestibular ocular response. So moving her head doesn't make her dizzy. Moving her body doesn't make her unsteady or have any problems. It's primarily the visual and the auditory stimulation that's overwhelming to her. And she can't hear out of the left ear. So saccadimetry was great. It was accurate. It was fast. I mean, slightly slower to the left, but not out of the norm. Head thrust with visual fixation, not a problem. She can keep her eyes fixed on the target while her head is, while we do a Halmagyi to the right or to the left or up or down. Posturography, the most significant finding is eyes closed. When she closes her eyes, she just cannot maintain balance, and whether it be perturbed or unperturbed. In the initial time I tested her, she was most stable with her head right, and that just did not reproduce, but on the first day, that's how it was. She mostly falls backwards. And here are her VNG findings. I would say the most pertinent VNG findings for saccades were good, but when you look at the pursuit mechanism, you see that her ability to move her eyes to the right in the pursuit motion, it's good when it's really slow, like at 0.1 hertz, but when we go to 0.2, she can't make it all the way to the right, and she overshoots to the left, which is the downward slope. And then the faster it goes, the more of a problem it gets. Her eyes just like being to the left, but they don't want to be on the right side. Okay? And then on the vertical, they look a lot better than they do on the horizontal motion. If anything, it looks like they might prefer to be you know, in the up position versus down, but you know, that's just a subtle finding compared to the horizontal one. Now the optokinetic response also revealed just how difficult it is for her to pursue to the right. When you look at those rightward, just look at those rightward OPK, the pursuit phase is what would take her eyes to the right, which would be in the upper part of the graph when looking at that top one. And she just can't get there. You know, her eyes just hang on the left side. But when you look at the optokinetic to the left, you know, it mostly hangs right in the center where it should be. So this is where we were with the VNG findings. So I just wanted to do a little test on that first day and see, okay, maybe we could do something and see if there's a chance that we can help this patient. So what I did is I did a right gaze stability exercise, and also did a right optokinetic stimulation, and it made her much more stable to the point where she was able to maintain her balance with her eyes closed, which she could not do before. And so I put together a small regimen for her. I was doing some right horizontal canal barbecue roll, and that's really rolling left. So we start with the head turn to the right and hold it for a couple minutes, and really, really slowly move to the left into the left position and do a full roll. So every quarter turn I hold about 1 to 2 minutes. Okay, so we turn towards the left all the way around. And then the eye strategy that I used is a left Halmagyi followed with a right pursuit on the Focus Builder app. It says there speed 3, but I really started her on speed 1, which is the slowest speed, and she would repeat that 5 times. And the outcome was that her balance was just significantly better. She was able to close her eyes and maintain balance, and the last time I saw her, she could even extend her head back and maintain her balance without falling. It was really, really great. Initially, as she progressed, what I found is that her balance was better. Her startle is really impressively reduced. It's really incredible how much it's reduced. But she still had some cognitive issues, and so especially with memory, and I expect that would improve over time as the right and left vestibular systems centrally become closer to balance, and as her energy increases. But I gave her some memory exercise using our new memory exercise on the Focus Builder. But we're not going to really get into that. Well, let's just focus on what we did on the Focus Builder app first. So what I did is I programmed a right pursuit. So if she has a vestibular system centrally that is wound up on that right side, you know, it's hyperactive, hypersensitive. You could say the left brain's perception of the right side is heightened as well. But if it's hyperactive, a right pursuit should have a dampening effect on velocity storage on that right side. And so we want to calm down that right side. We're going to do some extra slow pursuits. And I started her at a speed of 1, which is the slowest speed. And let's see here. It's set on continuous, but I did it about 5 times. And what I would do is when I start it up like this, the dot doesn't move. It just stays right there in the center. And I would instruct her, actually in the office, I would do the Halmagyi for her, but at home she would do it herself. So we would do a left Halmagyi to help push the eyes towards the right, and then tap the screen, and she would pursuit to the right. Okay, she would do this exercise 5 times. This is where we were, and that's what was appropriate for her. Another thing that I could have done is I could have done a saccade to the right first, followed by a right pursuit. But the left Helmag is good because centrally, her left vestibular system is functioning at a much lower rate than the right one. So the right pursuit calms down that right side. The left Helmagi activates the left side, and it brings it to the balance. It's a really good combination. What's really outstanding is the outcome. I mean, her startle is almost completely gone. I can speak with her and do hand gestures, and she doesn't have to close her eyes. She's not blinking like she was, and she can look out the window and see cars driving by, and it's not bothering her. She's able to drive herself, and she's able to do so much more than she ever could before, and it's just outstanding. And this is a patient that I didn't know, honestly, that I could help when I first saw her. I was a little intimidated by the significant surgeries she had and all the work that was done and all the people that she had seen. But when you just apply yourself and do your exam and try to work on the things you can work on, it's just incredible how far-reaching functional neurology can be, and how much we can do for people that think that their life is over. So I hope you enjoy this, and please feel free to give us some feedback.